It is a common anxiety that our cognitive fate, and specifically our risk for dementia, is permanently sealed by our genetics or our early childhood. But this chart reveals a significant biological advantage. Data from clinical case reviews show that bilingualism serves as a powerful neuroprotective factor, delaying the onset of dementia symptoms by 4.5 to 5 years across Alzheimer's, frontotemporal, and vascular dementia. A 5-year delay in symptoms represents a substantial extension of independent cognitive life when compared against the current reach of standard medical treatments. We are going to look at the brain scans that explain this phenomenon, explore why this benefit is available regardless of your education level, and outline the exact steps to start building this protection. Learning a second language appears to build a documented layer of defense that keeps the mind operational well after the physical structure of the brain begins to fail. We can measure the physiological evidence for this defense mechanism directly in clinical data. FDG PET scans reveal cerebral hypometabolism, the physical degradation driving Alzheimer's. Bilingual patients show more severe degradation at the same clinical stage. Yet managing 2 languages strengthens executive control and default mode networks, acting as a bypass system to function despite tissue decay. The act of bilingualism literally builds a highly resilient network that completely outsmarts the physical disease by actively rerouting signals around the damage. It is often assumed that a biological defense of this caliber requires specific personal advantages. However, longitudinal studies tracking individuals from age 11 to well past 70 prove this benefit operates independently of a person's baseline childhood IQ. These neuroprotective benefits are documented in illiterate patients. Success is not tied to formal education. Data also shows a positive impact for individuals who acquire their second language as adults, even when they start learning long after the supposed critical window for brain plasticity has fully closed. Cognitive reserve is accessible regardless of early education, inherent intelligence, or the age you begin. Building this reserve starting tomorrow requires a focus on a specific kind of practice. This graph shows that the degree of active, frequent use is what correlates with functional neural reserve. The priority is maintenance rather than perfect mastery. Using a phone app, an audio course, or a community class provides the necessary workout if practice is consistent. There is no pressure to become a polyglot. Research indicates no additional delay in dementia onset for speaking 3 or more languages compared to 2. The act of second language use buys time, roughly 5 years of symptom-free life, by allowing the brain to work around physical degradation. Starting a habit of consistent use today begins the process of rewiring your brain's architecture for the future. This resilience is built through the daily, lifelong practice of learning and using a new set of words.